Well, this is my first ever Facebook Live, and I'm having some technical problems, so I hope that this is coming through. I'm Cathy Yelf, and I'm talking to you from my office, my home office, not far from our main head office in Andover. I live in a village just outside Andover, and all the Macular Society staff are now working from home. So this is really an opportunity for you to ask me any questions that you may have, either about what the Society is doing or about what is happening with eye treatment in particular. I know this is a big issue for many people now as we move into the sort of third or fourth week of this really quite extraordinary time. So it is an extraordinary time and a very worrying time, I know, for an awful lot of people. So I just wanted to tell you a little bit about what we're doing, the Macular Society, in this period. And then if you do have any questions, then pop them onto the Facebook page, and I'll try and answer as many as I can. Those that we can't answer yet, what we'll do is we'll go away and try and find some answers for you and come back and posting these answers, or I'll come back and do another live later in the week if we can find the answers to the questions that you have. So what are we doing? What's the Macular Society doing at this moment? Well, the critical thing that we want to do is to make ourselves and keep ourselves available for anybody who needs our services. So we are trying to keep all of our services working as much as we possibly can. And in fact, in one way or another, pretty much all the services are still working. So, of course, you may know that we have a lot of local support groups, peer support groups run by our network of fantastic volunteers all over the country. Now, clearly, as face-to-face meetings, these can't work at the moment. We can't have those. People can't come together in groups anymore for the time being. But those groups are meeting increasingly virtually, either by this sort of technology, video technology, Skype and that kind of platform, or just as teleconference calls. And these are proving to be really quite successful. And we're having a lot of suggestions about what we ought to call these groups. So a great suggestion that has come from our Bont Green group, for example, has been the chin wag, which is quite a good way of bringing people together on the phone so that they still have that kind of friendship and fellowship that are so important with our group networks. So, in fact, increasingly we're finding ways of ensuring that our groups do meet after a fashion, not in the way that they normally do, but after a fashion. Obviously, our advice and information service, which is a telephone service, is working perfectly normally. All the advisors are now working from their own homes, but the technology allows us to divert the calls straight through to them, and they're being answered in absolutely the normal way. So you can feel completely confident about phoning the advice line for anything that you want to know. Lots of our other services, so our befriending service is becoming very important. That's a telephone-based service. And in this time of increased isolation, then we have lots of new volunteers who have come forward to offer their services as telephone befrienders. And if you would like to do that, then please contact us through the Advice and Information Service. And if you feel, or you know somebody you feel would benefit from this service, a regular call really from people who understand sight loss, understand macular degeneration, then please contact us and we'll put you in touch with somebody. The other thing, of course, that's operating perfectly normally is our telephone counselling service. This is a professional, confidential service provided by accredited, accredited professional counsellors, and their services are available again through the information and advice line if you feel that would be beneficial. And we know at times like this, when actually people who you may feel that you're coping really quite well, but under these extraordinarily stressful circumstances, it wouldn't be at all surprising if people felt, actually, I could perhaps do with somebody to talk to about some of these anxieties that I have at the moment. Completely normal. So please do feel that you can call us. That service is operating normally. All our services, as you know, are free, so you don't have to worry about that. And all of them mainly accessed through the Advice and Information Service. I'll give you that number now, but I'll give you the number for the Advice and Information Service again before I finish. So 0300 30 30 111. That's 0300 30 30 111. Call that number 9 to 5, 5 days a week for access to all our services or for any questions that you might have. So because we've been actually really quite organised, although I say so myself, we have got all the staff working from home. So the charity is operating pretty much as nearly as we can possibly make it normally. We do have some challenges. Of course, we're going to have some challenges. One of our challenges is, of course, for our research programme. So we're about to put out our annual call for the research community to apply to us for our funds. We've got £1 million that we're trying to invest in research this year. And we know that a lot of our researchers are finding this a challenging time. Sometimes because, of course, they need to work with patients on their study and their clinical trial that they're doing. And of course, we can't get patients into hospitals for that kind of routine, non-urgent treatment or non-urgent appointment. So that's a challenge for some of them. Some of them, of course, have sickness within their own team, and that means that the research projects will take a bit longer, perhaps, than originally intended. But we're, again, keeping that operating and keeping this going as much as we possibly can. And we will, as I say, be putting out our call next month to the research community as usual to invite applications for funding. So some of the challenges, though, the main challenges at the moment are going to be around our fundraising. This is going to be a challenge for us now going forward and possibly for the whole of the rest of the year. So, for example, we've just put out our spring raffle, and of course that requires people to go out and post their raffle ticket stubs back to us, and of course that's, we understand, completely going to be quite a challenge to do. We also know that our printers and our mailing houses and so on are all struggling to keep going under these circumstances. So there will be challenges in fundraising, and we may have to change the kind of fundraising that we do during the year to ensure that our income comes in and we can keep our services and our research programme going. So I know that I've been asked now to mention a couple of questions that are coming in. So we know, for example, that I didn't mention when we were talking about the support groups, that of course we actually do have some other Facebook groups that are also providing support. And on Facebook, if you have an inherited macular dystrophy or you're a working age person and you want to connect and share with people, then we have a working age and young people's Facebook group just for you. It has hundreds of members now, and it's a really useful forum for exchanging hints and tips and news, information about access to work, all sorts of things that people have found useful for themselves. To be able to share that with each other is really very useful indeed. So have I got some other questions coming in? But I'm not sure I can find them at the moment. There are a number of questions I know that were coming in to our advice and information service regularly. And of course, the big one that is coming in now, particularly from people who are having injection treatments for their macular disease, is whether they should attend hospital to have their injections. So we've been talking to the Royal College of Ophthalmologists about this. And it's quite clear that at the moment, and this is a changing situation, but at the moment, the advice is that people who are having injections should still attend the clinic unless they're asked by the clinic not to. Now, at the moment, we believe that injection treatments are still happening. Clearly, if you are ill or you think you might have a coronavirus infection, then you will be asked not to go to the hospital. The worry, I imagine, for most people will be is I'm putting myself at risk. I'm being told to stay at home and isolate, but actually at the same time I need to go and have this injection, otherwise my sight's at risk. And that's a very worrying dilemma to be in. So we've had a lot of conversations with the Royal College of Ophthalmologists to say, well, what is actually the advice to people here? And their advice is pretty clear at the moment that people should attend. The hospitals are going to be relatively quiet because a wet AMD treatment will be treated as pretty urgent treatment, but lots of other routine appointments have been cancelled. So you shouldn't go to a hospital and find the enormous, cramped, overcrowded circumstances that you do find in many ways. So the hospitals will be quieter. Many of the clinics are trying to segregate older and vulnerable people from other waiting areas so that they have an additional area of protection. There will be hand sanitizers and all that sort of thing when you go in and when you come out of the hospital, and the staff themselves will be taking precautions to make sure that people are as safe as they possibly can be. So at the moment, we understand that is the advice to go. It may be that you're in between appointments or monitoring appointments are being cancelled. If you're concerned and if you feel that your sight is dropping, that you can sense that something is not right, then at the moment the advice is to phone the clinic and speak to the clinic themselves about what you should do. Speak to them directly. You should have a number for that. So here we are. Sorry, I'm just trying to find the question that I've been asked, but I can't find that. I know that another question that's coming in, though, is transport. So getting to hospitals is also proving to be a bit of a problem for some people. I think that in some areas the hospitals are hospital transport has been suspended, but if you can't drive yourself or you can't get a close member of the family whom you're living with to drive you, then I can understand that this is a bit of an issue. At the moment, the advice, the best advice that we have is that you can ask a neighbour or a friend, perhaps somebody you can ask to make sure that they have been reasonably self-isolating, whom you feel you can ask to wear a mask, or you don't mind if you wear a mask in their car. There are lots now on Facebook and around in the villages and in community groups now setting up to help people with these circumstances. I know in the village where I live here, we have this service already starting up now. It's been going for a week or so, where people can phone a number and say, I need help. And other people can phone and say, I'm in a position to offer help. And they put the two together. So that may well be happening in your area, and you may be able to find that from your community groups, from local churches and that kind of thing, or from your magazine, your parish council, or maybe from local Facebook groups. We have a Spotted in Andover group here, for example, and there are lots of people posting help on that. So there is help around. And I know that the government yesterday was calling for this army of 250,000 volunteers to help people, possibly in these circumstances. So there may be ways in which you can find somebody to help you get to the hospital. If you do have to travel on public transport, again, in most areas out of rush hour, public transport should be very, very quiet. Now, there should be virtually nobody on it. But if you do have to travel by public transport, take some wipes with you. Make sure that you're not touching your face, that you can wipe the area around you and the things that you have to hold on to, the grips and the seat backs and that kind of thing, so that you can keep yourself as safe as possible. And sanitize and wash your hands frequently, all the time, if you have to do that. So those are the sort of questions that we're definitely getting in at the moment. I've got another question here. Can I contact my regional manager, or can the society pass on my number to another member of my group? We made friends but never exchanged contact details. Okay, it's a bit cryptic, but I think almost certainly the answer is yes. I'm not quite sure what that entirely means. But yes, you can contact your regional manager. Phone the Advice and Information Service. This is the best line to call, because they can put you in touch with any other area of the charity, including the regional managers. So yes, if you're trying to get in touch with somebody that you met but don't have the contact details for, then contact us and we'll see what we can do to put you in touch with each other. Okay. Can I ask if there are any other questions that are coming in? I haven't got any on my screen, but I may be missing something here that I should be looking at. I'm going to ask my Facebook guru, Felicity, to tell me whether there are any more questions coming in. There may be questions that occur to you after this. Post them on our Facebook page, and we'll come back to you with any questions that you may have. In the meantime, I'm going to wish you goodbye, good luck, and good health. Stay care. Bye-bye.